Hello everyone, my name is Ahnet and my project partners are Zirya, Nurshad, Nursezim and Julduz. Now we are going to illustrate our project work about major health issues in the Kazakhstan. So let's start from the introduction. Kazakhstan, the largest country in the Central Asia, faces several major health challenges that affect the well-being of its population. These health problems are influenced by lifestyle habits, environmental factors and the healthcare system. One of the most serious issues is the high rate of non-communicable diseases such as cardiovascular diseases, cancer, diabetes, and respiratory illnesses. And these diseases are the leading causes the deaths in the Kazakhstan, mainly due to the healthy diets, lack of physical activity, smoking, and the excessive alcohol consumption. Many people suffer from the high blood pressure and obesity, which is increase the risk of heart attacks and strokes. So, next about general statistics. The right side of the slide we have a detailed cause of this 2021, and on the left side of the slide we have the life expectancy at birth, the average number of years that a newborn could expect to live in Kazakhstan. In Kazakhstan, life expectancy at birth has improved by 5.92 years from the 64.4 years in 2000 here to the 70.3 years in 2021.
Good afternoon, everyone. Today I'll be discussing obesity in Kazakhstan, a growing public health concern. To start, I want to present this visual representation taken from the Global Nutrition Report to make the trend clear. What you see here is a graph showing the prevalence of obesity from 2000 to 2020 for both males and females. Both graphs show a steady increase, indicating a rising trend. Percentages of females with obesity rose from 15.8 to 25.5, while percentages of males rose from 11.7 to 21.4. Also, according to this report, Kazakhstan has a higher prevalence on a regional average of 10.7 for females and 7.5 for males. Also, World Health Organization indicates that around 21% of children aged from 6 to 9 ages in Kazakhstan were living with obesity or overweight as of 2020. This means the urgency of addressing this issue. Now let's explore what factors contribute to this problem and what actions can be taken. Several factors are driving this issue in Kazakhstan. First one, dietary major shifts toward processed and fast foods with increasing consumption of sugary beverages has significantly altered dietary habits. Also decrease as physical activity due to changes in work environments and transportation. And the last one, economic growth has made fast foods more accessible and affordable. Also, it might lead to several consequences, including cardiovascular diseases, type 2 diabetes, and some types of cancers. Nurshad will introduce these topics a bit later. Also, the World Obesity Atlas 2023 reports that global economic impact will reach $4.32 million by 2035. Also, National Institute of Health says that obesity might shorten life expectancy up to 14 years. Now let's explore what actions can be taken. Kazakhstan has implemented several initiatives, including dental healthcare program, school nutrition guidelines, and national strategy for the prevention of childhood obesity and overweight. But now let's talk about what World Health Organization recommends. It recommends clear labeling and taxing on unhealthy foods. Also, organizing educational campaigns, raising recreational areas are also recommended. Also, for the children to make healthy foods more accessible in schools, taxing advertisements of unhealthy foods and beverages.
So now I will talk about the non-communicable diseases and their types. Non-communicable diseases such as cancer, cardiovascular diseases, diabetes, and their risk factors are an increasing public health and the development challenges in Kazakhstan. And these figures show the cause of death by non-communicable diseases in 2019 in Kazakhstan, and it accounts the 86.68% according to the World Bank. So next figure showed the prematurely deaths caused by the non-communicable diseases in 2019 in Kazakhstan, and it accounted 22% with a high probability for men 31% and for women 15% according to the World Health Organization. Now I will talk about the three main types of non-communicable diseases. The first one is cardiovascular diseases. It's a disorder of the heart and the blood vessels, and it includes the coronary heart disease, rheumatic heart disease, and the cerebrovascular diseases. And the main behavioral risk factors include the tobacco use, harmful use of alcohol, physical inactivity, unhealthy diet. And amongst the environmental factors, the air pollution is the most important, and the cessation of tobacco use and the regular physical activity, eating more fruits and the vegetables help to reduce the risks. And the next is diabetes. Diabetes, it's a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body does not produce insulin properly. And the symptoms include the feeling very thirsty, feeling very tired, losing weight unintentionally, and the needing to urinate more often than usual. There are two types. Type 1 diabetes is known as insulin dependent. It's characterized by insulin deficient production, and it requires daily administration of the insulin. The next is type 2 diabetes, when the body stops using the produced insulin properly, and it can lead to a high level of blood sugar if not treated. So the last one is cancer. Cancer is the disease that can affect any part of the body. One defining feature of the cancer is rapid creation of abnormal cells, and it invades to adjoining parts of the body and spread to other organs. The most common cancer types in 2020 were the breast, colon, and the rectum cancers, skin, stomach cancers, and the cancer arises from the transformation of normal cell into tumor cell in multi-stage processes, which progresses from the pre-cancerous lesion to a malignant tumor, and this is the result of the interaction between the person's genetic factor and the three external agents, including the physical, chemical, and the biological carcinogens. And now Ziria will talk about the communicable diseases.
Communicable disease. We took these data from World Health Organization, and this data shows that communicable disease accounted for 26.9% of deaths, including tuberculosis, HIV, hepatitis, and also respiratory infections. Additionally, COVID-19 related deaths made up 8%, highlighting the significant impact of the pandemic on mortality rates. Additional data. We took these data from Forbes. This data shows that COVID-19 monitoring from 100 to 400 cases per month, indicating year-round circulation of this virus. The second is measles, the largest outbreak in 10 years, and 29,000 cases. 80% of patients are children under 14 years. And the last is measles vaccination. The second slide about main types of communicable disease. The first is measles, cause measles virus. Transmission method is airborne droplets. Symptoms is fever, rash, conjunctivitis, and diagnosis. Polymerase chain reactions, also blood test, for example, immunoglobulin G, immunoglobulin M, antibodies to measles virus. The second is acute intestinal infections caused by bacteria, for example, Salmonella or Shigella. The second is virus like
rotavirus, norovirus. Transmission method is fecal-oral. Symptoms is abdominal pain, fever, and diarrhea. Diagnosis for bacteriological stool culture. For virus is PCR, and the last is blood test for antibodies. The second type of disease is hepatitis A. Cause hepatitis A, HIV. Transmission method is fecal-oral, contaminating food or water. Symptoms is nausea, abdominal pain, and fever. And the last is diagnosis using blood biochemistry, for example, alanine transferase or bilirubin, blood test for immunoglobulin M and immunoglobulin G, and the last is PCR testing.
I would like to highlight the weaknesses and the strengths of the healthcare system in the Kazakhstan. Let's start with the strengths. First of all is mandatory social health insurance, which provides medical services by health insurance. The next is positive development is digitalization of medical records, which makes a healthcare system more affordable and accessible. Next one is accessible emergency care, which providing timely assistance in critical medical situations. And the last one is specialized medical centers providing advanced treatment and high quality services in complex medical conditions. And the next weaknesses is resource inequality between urban and rural areas, which is in rural areas there are lack of advanced medical services and treatment. Next one is medical staff shortage in remote regions. This problem is also decrease the quality of healthcare system. Long waiting time for planned care is remains a concern and causing delays in treatment. And the last one, limited funding for innovation and new medical technology. This problem is slowly improve the healthcare system. Biochemistry helps to enhance the quality of healthcare system by these ways, like disease diagnosis, drug development, genetic research, vaccines, and environmental chemistry. It's about like biomarkers helps us to detect the cancer or disease early, and CRISPR can edit DNA and identify the genetic disorder. Vaccines creating vaccines and study immune system. So generally, biochemistry helps us to solve the medical issues by new medicine technology.
In the era of global modernization, the issue of public health stays not only on local agenda but also international as one of the important concerning topics of social.
Kazakhstan should focus on preventing diseases and teaching people about health. Living a healthy life, reducing pollution, and improving healthcare will help people stay healthy in the future.
Cancers, cardiovascular diseases, diabetes are considered as non-communicable diseases, and that they are major health risks that link to the lifestyle factors, poor diet, unhealthy lifestyle, and that they emphasize the prevention.
With a coordinated effort across government, healthcare, and society, Kazakhstan can reduce obesity and improve public health outcomes.
Biochemistry plays a crucial role in diagnostic, treatment, and scientific innovations. And our country, Kazakhstan, is actively reforming its healthcare system thanks for government programs and digital solutions.
See you next time! Woo!